I want to welcome you to our Monday press conference with updates on COVID-19. We will now hear from our community leaders. First, we will hear from Mayor of the City of Albany, Mayor Bo Durr.
Thank you, Mr. McCoy. I don't have much, but I do want to complete. I was mentioning Saturday about my son's 30th birthday party, and I recognized Dr. Kitchens. I didn't go any further with that. My thought was Dr. Kitchen actually delivered my son 30 years ago to the day, and it's kind of a strange twist of fate that these two landmark events in my life that Dr. Kitchens has been involved in. I'm sorry I lost my train of thought there. And now the next line of discussion, we are having numerous complaints that people are not complying with the executive order in several regards. First, we're having people congregate in city parks, playing basketball, other team sports. Again, these measures have been implemented to protect the public, and no one is exempt from the social distancing requirements. Secondly, in convenience stores, in all retail establishments, please be cognizant of the fact that whatever the occupancy rate is rated by the fire department, the occupancy rate has been reduced to 50% of that number. We're having reports of people congregating in convenience stores in close proximity to each other. And then with some of our building supply stores, some of the big box stores, there are reports that these establishments are not recognizing and respecting the limits on occupancy. Again, we understand that retailers can't be responsible for everybody who comes in the business, but please consistently remind customers, the public, to maintain social distancing. And also the recommendations that we discussed Saturday, if you are ill and you go out in public, please wear a mask. Also, I want to reiterate, if you have been tested for COVID-19 and you are awaiting the results, you should not be out in public. Do not use public transit. Do not go into a store. Please remain at home. This is for your safety, but for the safety and also for the safety of the general public. Thank you. That's all I have, Mr. McCoy.
Thank you very much, Mayor. At this time, we will hear from Dougherty County Chairman Christopher Cohilas.
Thank you, Mr. McCoy, Mayor. Today, I feel like I need to reiterate the order that we've issued and reiterate that we need people to shelter in place. I also want to thank the public for bringing it to our attention that we have certain good corporate partners in this community that have been encouraging social distancing, and we have also had some corporate partners that have not been living up to their end of the deal. And I want to thank the public for bringing that to our attention. Just so you know, each day we have a task force meeting where we discuss strategies in order to better enforce, A, the order, and B, bring safety to the community. And so what we will be discussing today and tomorrow is rounding out that enforcement strategy. We do have enforcement officers and law enforcement officers that have been going and visiting these businesses, taking video that they've received, spot checking, and telling them that if they don't comply with the order, then they will have to be shut for business. Again, I want to reiterate also as it relates to restaurants and food service businesses specifically, these businesses should be practicing curbside and or drive-through options only, with no customers actually coming into the restaurant. We have had a very busy couple of weeks, and I want to thank Phoebe Putney and the nurses and the medical staff there that have worked very, very hard and very diligently under extreme circumstances. Those people have worked day in, day out, many without a break at all, and they have done so in the face of having to put themselves at risk. I also want to acknowledge our first responders who have been working daily very, very hard and have been putting themselves at risk. Specifically, our EMS department. They have seen a huge increase in the uptick of calls, and they have to literally respond often and take these people in that have gone into a certain state of crisis because of COVID-19. I say all that not to alarm people, but to remind people that it's very real and it is taxing on the people that are on the front lines and working very hard. The past couple of days, I've had numerous discussions with the governor, with the governor's office and his team, as well as with respect to the White House team that is assigned to this region. We have secured a lot of resources for this community. I want to publicly thank the governor for making staffing resources available to Phoebe. I believe that you will hear from Phoebe soon about what will be happening at Phoebe North. You will see that will happen in a couple of stages. We're going to be bringing Phoebe North up and running thanks to the help from the governor, him making staffing available to us. Additionally, you're going to hear positive announcements about the testing results that will the new testing capabilities that will be coming into Phoebe that will allow them, as this new service ramps up, for them to be able to get test results back to the public far, far faster. One of the problems that I've noticed in this problem at the very beginning is that there was a 8 to 10 day lag in test results. Therefore, you have 5 to 6 days in terms of incubation period for a person to realize that they've got the virus or potentially have the virus. They then become symptomatic, they then go and get tested, and then it's 8 to 10 days later before they actually get a result. In some of those instances, they've already moved through the virus, or something tragic has happened, or they've moved on and actually infected other people. So a lot of the numbers that you're going to be hearing in terms of positive test results are not things that happened in real time. They are related to things that happened 8 to 10 days ago. This increased testing capability will improve our community's ability to respond and isolate certain pockets of infection, and will allow us to operate more surgically in doing so. I'm also very pleased to announce that Phoebe and our community have been very pleased to welcome General Thomas Carden, who's Adjutant General of the Georgia National Guard, as well as General Randall Simmons, Assistant Adjutant General to the main campus. These generals and their team saw the Phoebe Command Center in action and spent almost 2 hours speaking to our leaders at Phoebe. And they have applauded our hospital's efforts and stated that they would be taking all that information back to the governor. The National Guard now has 3 medical teams deployed here to assist with COVID-19 response at Phoebe. The group of 29 includes 1 physician, several advanced practice providers, several nurses, and 20 emergency medical technicians. I want to say to them, thank you for your service, thank you for your service to the state and to this country and to this community. Again, I expect you will hear positive updates from Phoebe, and again, I want to thank the governor for all of the help that he has made available to us. And I want to assure everyone that we are in constant contact with the governor's office. I talk to him almost daily. Very thankful for the resources that we have received and that we continue to receive as we try and combat this horrific disease that has been splayed upon our community. I also want to remind everyone, please shelter in place. Continue to pay attention to the press conferences. We have a lot of additional moving pieces that we're going to have to roll out in terms of policy. Some of the things that I'm considering talking about with my team are, how do we better make grocery shopping more accessible and more safe for our citizens? And one of the things that we're talking through is how we may or may not prioritize certain times of shopping for our more vulnerable shoppers. So I want everybody to know and understand we are listening. Thank you for the information that you make available to us, and please stay safe and shelter in place.
Thank you, Chairman. At this time, we will hear from the Lee County Commission Chairman, Mr. Billy Mathis.
The good news first, Lee County and Leesburg residents have been very cooperative in regard to the restrictions that we've placed on the community as well as in social distancing. The grocery stores, just as a point to follow up with Chris, the grocery stores in Lee County have been very orderly. We appreciate the citizens following social distancing guidelines in the grocery stores. I would like to say, when you go to the grocery store, please don't take your family. Go one at a time. Send one person to the grocery store. Don't take all the kids with you. Wipe your cart down. Stay 6 feet away from folks. But I've been a couple of times just to observe, and everything looks to be very orderly in that regard. The Lee County Board of Commissioners today will make one further restriction announcement. Starting at 5 o'clock today, all gyms, gymnastic and dance studios, hair and nail salons will be closed until April 30th. That goes into effect at 5 p.m. today. We're taking that action so that we can do everything that we know to do to get past this crisis as soon as possible. Everybody's getting a little stir crazy, but I would again urge the folks in Lee County to get out, take a jog, go walking, do the things you can do where you can social distance. We're a little bit different. We're not as dense a population in Lee County, so get out and jog, walk, ride your bicycle, do those things so you don't go stir crazy. But please, please continue to follow the instructions. And again, for the most part, we have seen Lee County and Leesburg residents do that. I won't come to every one of these press conferences. I'll only come to the ones when I have some information that's new to offer. But we appreciate the public support and we appreciate your cooperation.
Thank you, Chairman. At this time, we will hear from our Phoebe Putney representative, Dr. Black, who is the Medical Director for Emergency Medicine. Dr. Black.
Thank you. As is our custom, we will update you on the numbers. Currently, we have 586 positives, 932 negatives, and we still have 1,146 pending. Over the last 24 hours, we received a large batch of results, which has shown us that batch is 104 positive, 146 negative, and 9 deaths. But I want to put that into context. As Chairman Cohilas was saying, there's been a delay in getting some of the test results, and that doesn't mean that we had 9 deaths in the past 24 hours. That probably occurred over the past week to 9 or 10 days, but that's just a cumulative number that we had that was included in this batch. We don't report those deaths until we get the test that's been verified back and listed as a cause of death. That brings our total to 27 deaths. Currently, there are 69 positives in the hospital and 86 patients that are concerning for the possibility of COVID-19. Thank you again.
Thank you, Dr. Black. At this time, we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Ruiz. Dr. Ruiz.
Thank you, Mr. McCoy. I also have some numbers to share. I trust that the coroner will talk to you about the Dougherty County numbers. Outside of Dougherty County, for our Southwest Georgia Health District, the 13 counties outside of Dougherty, currently we have a total of 16 deaths, 1 in Baker, 1 in Early, 5 in Lee County, 2 in Mitchell, 6 in Terrell, and 1 in Worth. And I should say that these numbers are constantly changing. What we tell you this afternoon could easily be different this evening, and certainly by tomorrow. If you have been listening to these press conferences for any length of time, I think you'll recognize that one common thread that connects us all together is we frequently talk about how things are evolving. For instance, Dr. Kitchen oftentimes will talk about the new things that they have discovered, the new innovations that they are putting into practice at Phoebe Putney. I was talking with Mr. Sam Allen, the EMS director, just a day or two ago, and he was telling me about a new idea that they had to help protect their staff. This is an evolving situation. There are no textbooks to go to learn about COVID-19. There's some very good guidance from the CDC available readily on the web, but we are all learning as we go. And this is true also when it comes to long-term care facilities. These folks are trying hard to take care of their residents. They are not experts in COVID-19, but they're learning as they go. And the Department of Public Health is providing support in that vein. We had members from the CDC to come here about a week or so ago. Some of them visited at least one of the long-term care facilities in our district. They held a telephone conference the next day, the next 2 days, for all of the long-term care facilities in our district. Just a couple of days ago, we had 2 members from the State Department of Public Health to come into this area. They are both experts in infection control, and they're going to spend this week here in this district helping the long-term care facilities to be as efficient as they can to take care of their staffs and their patients. Just yesterday, we went to the very first facility on the list. We visited Dawson Health and Rehabilitation Center in Dawson. I went along for a couple of hours, and I wanted to tell you what I found there. I found a staff that's tired. They are compassionate. I found a staff that's brave. I found a staff with several colleagues out because of illness. And also I found a staff there that was very receptive to hearing updated information from experts in the field. And so our team spent several hours there at that facility yesterday, training and observing, developing relationships that will continue on in the weeks to come. Over the next few days, this team will visit a number of facilities in our area to help ensure that residents and staff members of long-term care facilities are protected and that they stay in the best health possible. But I think we need to consider some tough reality when it comes to long-term care facilities. For instance, most have already instituted a lockdown or a restriction on visitation. I think there is some flexibility when the resident has a terminal illness, but even that's limited. So we are restricting visitation in long-term care facilities to protect those who live and work there. If we allow people to freely come and go in long-term care facilities, at some point we run the risk of a visitor bringing in the COVID-19 virus. Once that happens, once it gets into a long-term care facility, it is very hard to manage. We've all said on many occasions that the elderly in our communities are at high risk for bad outcomes from COVID-19. We have said that people with underlying medical conditions are at high risk for COVID-19 infections and bad outcomes. And that's typically what you find in long-term care facilities, people who are on up in years who usually have underlying medical conditions. Add to that the fact that in long-term care facilities, we have a limitation on how much we can practice isolation measures and social distancing. So we want to keep these infections out of long-term care facilities, but chances are the infections are going to get there. What we're trying to do is to prepare the staffs in these facilities to do the best job that they can to contain the infections, to recognize the infections when they develop, and to respond with proper treatment. But it would be naive for us to think that we're going to get through the next few weeks without having some more bad outcomes in long-term care facilities. We just want you to know that public health is playing a role in trying to minimize those bad outcomes. We're trying to keep everyone as healthy as we possibly can in those facilities. I want to say a word about first responders. Our first responders are brave men and women. They are here to help us, and they are here to work through the difficulty. I think the mayor said a day or two ago that they're the kind of individuals who run toward the fire instead of running away from it. At the very least, these people deserve honesty when they are being called to provide services to someone with a medical condition or someone who just needs some emergency help. Please, when you call for that help, let someone know if there is a COVID-19 positive patient in the vicinity. It's only right that these first responders know what they're getting into. They're going to be trying to take care of themselves and protect themselves with personal protection equipment anyway. But the sad fact is we don't have an unlimited supply of personal protection equipment. And so it would help us, it would help our first responders. We need for them to be healthy. They need to be able to respond to the next call and the next and the next. So please, if you are a victim of COVID-19, please don't make it worse. Please share that information. You will not be ostracized by just sharing that. It's so important that you do so. Another thing that's very important is if you are sick, please stay home. Don't take the chance of getting out in the public and spreading the infection. Call your provider for advice, or you may wish to have a virtual medical visit. That's a safe thing to do. And call your employer, tell your employer that you're staying home because you have symptoms that are consistent with COVID-19 virus, and you are simply following the directions of the Department of Public Health and the CDC. Thank you.
Thank you, Dr. Ruiz. At this time, we will hear from the Dougherty County Coroner, Michael Fowler. Mr. Fowler.
Good afternoon. I'd like to say, let's keep the ones in prayer that lives have been lost during this time. Many of our friends, co-workers, some family members. Let's keep them in prayer because it's people that you know that are falling dead. Many of them didn't have time to say, you didn't have time to say goodbye to them. But I'm trying to say, let's keep the family in prayer. This is a serious time. At this time in Dougherty County, the numbers that we have, the residents of Dougherty County, we have 24 residents of Dougherty County that have passed. We have 6 more waiting on the test results to come in. As soon as the test results come in, we'll give you those numbers. But right now we have a total of 24 Dougherty County residents. I know you hear Phoebe tell a number, and most time they tell a number that died in Phoebe hospitals around the Southwest Georgia of Phoebe. But I try to work with getting the count from outside of the hospitals at Naviston, Eggleston, from Savannah, different places, and the resident that was here. So 24 from Dougherty County that have died in our city during this time. So let's keep those families in prayer. Thank you.
All right, thank you, Coroner Fowler. At this time, we will open the floor for questions.
I'm sure that information has been compiled, but I don't have it off the top of my head. I'm sorry. It's safe to say that there's a broad spectrum of diabetic manifestations on patients. Some people have very mild cases that are managed entirely without medication. Then on the other extreme, we have people who are on insulin shots multiple times a day. Some people have early cases of diabetes with no end organ damage, and others have lived with it for decades and may already have secondary problems with their kidneys or their heart or other body parts. And I think it's safe to say that the more severe a person's diabetes might be, probably the more risk they are whenever they might be confronted with a COVID-19 infection. But as far as detailed numbers, I'm afraid I don't have that right now.
Do we have any other questions? No other questions. This concludes today's press conference. Thank you for joining.